those that don't know me, my name is Sean Secord. I'm with the Yukon Registered Nurses Association. And I'd like to welcome everybody here tonight and start off by giving thanks to the Tuan, Gwachin, and the Kwalendon First Nations on whose traditional land we are gathered this evening. Secondly, with Thanksgiving just recently behind us, I'd like to give thanks to all of you, my colleagues, my friends, my neighbors. Yukon's been home for me for the last 15 years, and for that I am very thankful, because it's made up of people like you. I'd also like to express my thanks for nursing. I didn't start out on the nursing path when I first graduated from high school. I kind of fell into it, but it's been incredibly rewarding. As I've said before, there are several polls and surveys that place nursing either at the top or near the top of the most trusted professions, and it's very honorable to be part of that group. A mentor of mine once said that in no other profession does one become so involved in another's life or lives. And I do make the distinction because a lot of people just think of nursing as one person caring for another person, but of course nursing is not just about individuals, it's about caring for families and populations and communities, which is part of what led to tonight's forum. Also, nursing is one of the only self-regulated professions where we pay dues and volunteer time to have a professional association and a regulatory body where we help to protect the public and ensure a certain level of competency when somebody joins the profession and a continuing competency throughout, and advocate for a healthcare system through which we know we can make a difference. It was through this role, both locally and nationally, that we noted the absence of healthcare issues on the national platforms for the election. I'd like to thank Ms. Atkinson, Mr. Bagnall, and Mr. Leaf for agreeing to come to tonight's forum. I'm sure everyone knows that although this has been the longest campaign since, I think it's 1872, the last couple of weeks especially have been very grueling. I heard Melissa on the radio first thing this morning, and these guys are doing 1 to 2 forums a day. So I am very appreciative that they made time for us and the healthcare platform. Also, I don't know, they get a lot of ridicule, but as soon as you run for Parliament, you are never going to make everybody happy all of the time. So the scrutiny and the criticism that tends to fall on people that do this, I think is worth a mention, and I'd like to personally thank all of you, because I believe that the people that do run for politics do so because they want to make a difference, both locally and nationally. So I believe that all of our candidates, and unfortunately because of that grueling schedule, Mr. Bagnall, Mr. Leaf, and Ms. Atkinson are the only ones that could come out tonight. But I'd like to thank them for all they've done thus far. And in that vein of respect and professionalism is how I'd like to have the forum tonight. We did give questions to the candidates, so there's 4 questions that they have prepared. But after that, there'll be time to have some questions from the floor. However, well, it's a small group, so we can let that rule go. I was going to say 1 question per person, but the other thing I was going to say is make sure it stays on healthcare, but again, given the group, I'm sure that's where we'll stay. The questions, we gave an agenda out so that allocated 5 minutes per question, which is plenty of time. So at 4 minutes, I will ring a bell, and I had a hard time finding a bell, but I did find a stethoscope and a glass.
Perfect.
So I can do that at 4 minutes, and then when you get to that point, you can have some closing thoughts to what you're saying. With that, we'll get started. So the first question. Nationally, the theme for this election appeared to be circled around the economy, the justice system, and international relations, with not a large focus on healthcare. I was told that healthcare platforms don't sway the vote very much. Most Canadians just assume that we have a good system, it'll always be there. So putting a lot of energy into healthcare doesn't always make a big difference on a national platform. Yet, Canadians are quite proud of our not-for-profit publicly funded system, and it is by definition part of our health and well-being. What are your thoughts on Canada's healthcare system and its place in a national election. And once I find my schedule, we'll start with Ryan.
There we go. Thank you, Sean. Can everybody hear me okay in the back? Okay, I'll try and project loudly. Sean, thank you for organizing this, and to my fellow candidates for being here. I purposely, we got these questions ahead of time and purposefully didn't prepare a canned response, because I think in this group, the question is really at the heart of what are my thoughts on Canada's healthcare system and its place in the national election. And we had a question at the F.H. Collins Forum. I think it went along the lines of if you had a department that you could decrease and a department you could increase, what would they be? And my response to the increase question to that was, in fact, healthcare. I fundamentally believe that health of Canadians is first and foremost. If you have your health, then you have the ability to take advantage of everything else life has to offer you. I know that, and I believe in that from being an athlete all of my life, having good fortune and good luck sometimes to enjoy my health, but having people around me that supported that, and opportunities in this territory and opportunities in my life to be a healthy person, and I want to impart that on our territory. I want to lead by example, demonstrating the things that you can enjoy when you're a healthy person. There's a couple of roles, of course. The question mark is what role does the federal government play, and what role do provincial governments and territorial governments play? Because healthcare is a fairly closely guarded portfolio for the provinces and for the federal governments. We have a unique system in Canada from coast to coast to coast, where priorities in provinces range quite a bit. How many people in the room, by show of hand, are healthcare professionals in one form or another here? Okay, so nobody. Great to see you all here. So, I'm pushing on an open door, most certainly, when we talk about some of the challenges that we have, but some of the opportunities that lie before us. And it's always a pleasure for me to meet with the Canadian Nurses Association when they have their day on the Hill lobbying in Parliament. We talk about these very issues. Healthcare, to me, is dynamic. It's not just about a system. It's about all of the other things that support a healthy Canada and a healthy territory. Those range from food security to housing to dietary choices to chronic diseases that can be either genetic or develop later in life through other related causes, whether it's mental illness or accidents. And that requires us then to look at a system where we're supporting the groups and organizations that can identify what's leading to an individual's health outcome. Those things change, of course, and this is where the complexities come in, but the great opportunities in our territory evolve. What the priorities in Watson Lake are, or the needs, are different than those in Beaver Creek, are different than those in Watson Lake, Pelly Crossing, Old Crow, and all points in between. The capacity in each community to deliver those services differs from each community. Whether it's the healthcare professionals there, whether it's the groups and organizations invested in housing, social support systems, dietary choices, positive health outcomes on a range of fronts, addictions and mental wellness, athletics, sports and coaching, arts and culture investments, and people that are engaged in their community to inspire the first generation to not be a generation that's aging with illness. Groups and organizations that work with our seniors to help them age in a healthy and active manner, whether it's a Golden Age Society or whether it's a small group in a community. Each community, in my mind, and our government's role in this, is to make sure that we partner together at a federal, territorial, municipal, right down to an NGO or a family-based level. Thanks, 1 minute. To determine exactly what the priorities and capacity of that community are, find community-based solutions for those challenges, embrace the opportunities that we have, and move forward with them. That takes funding, it takes education, it takes capacity development, and it takes passion at the level that we're all at. Your passion and the passion of the leaders in your community. And I can tell you, every meeting that I've had with the Canadian Nurses Association, I've tried to demonstrate my passion and my own personal leadership in this field, And I think it should be a significant piece of our national discussion when we're in elections. So thank you for being here. Thank you for the invitation. And I look forward to continuing to work with you.
Thank you, Ryan. Just to reiterate before you start, Larry, I won't do the whole preamble, but the question is, what are your thoughts on Canada's healthcare system and its place in a national election?
Well, thank you, Sean. And thank you all for being here, and thank you for taking an interest in improving the healthcare system, because you of everyone will know best. You're right on the ground. You know what you can recommend to us. That's very, very important that you get involved and tell us what you think and how we can improve the system. Of course, we all believe in healthcare, and I could say the niceties about it, but we also have to, if we're going to fix it or make it better, take some concrete action. So today I'll try and go over some of the technical concrete actions that we promised, and you could tell me later whether you think they're a benefit or not. Of course, I'm a huge supporter of the nationally funded, publicly funded universal healthcare system. It's been more than a decade since the premiers met with the Prime Minister to come up with an accord, to come up with an agreement on healthcare to move it forward. So one of the first things Justin would do is call all the premiers together for a specific meeting on healthcare, so we can come up with an agreement, come up with long-term funding. And that way we'd start collaborative federal leadership. We would, since the last health accord, which was 2004 to 2014, has just expired, we would negotiate another one. And I'll tell you more details about that in question 3, because I won't have time in this question. One of the major part of our healthcare plank is to add $3 billion to home care services, which I think you'll be very excited about. The Canadian Nurses Association, in fact, had an entire initiative called Home is Where Health Is. It was based basically on that, increasing home care. And to do that, we'll increase high quality in-home caregivers is one of the items, financial support for family care, and where necessary, support for palliative care. This will help implement recommendation number 6.9 of the Yukon Clinical Services Plan of 2014, which I know your association is interested in moving forward on. Another item in our platform is a pan-Canadian collaboration on health innovation, so we can support innovation in the healthcare field, and I'll talk more about that in question 4, because we don't have time in this one. Also, improved access to necessary prescription medications. One of the things there we'll do is we'll buy them in bulk. We'll get together with the provinces and territories so we can buy them in bulk and lower the prices. And I'll say more about that in question 3, because I won't have time in this question for that either. We're also going to have high quality mental health services, more affordable, including for veterans and first service providers. And I'll say more on that in question 4, because I won't have time now. We're also going to expand the EI Compassionate Care benefit, which I will describe in question 2. One thing I do want to talk about, though, is prevention. I meant to start out my whole talk with the fact that my whole philosophy of government, of being in government, is prevention, as opposed to waiting till you have to solve things. You prevent human tragedies, and it's a lot cheaper to invest. It costs money, but invest earlier. So prevention is a big part of my personal philosophy. And one of the ways to prevent disease and unhealthiness in children, I'm just going to give you some of the ideas that we're going to put forward for children. We're going to have new restrictions on marketing of unhealthy food and beverages to children, tougher regulations to eliminate trans fat and reduce salt in processed foods, improved food labels with more information on added sugars and artificial dyes, and give $15 million to the Public Health Agency to increase vaccination amongst children, and the awareness of concussions for parents and coaches and the treatment for them. And also have plain packaging requirements for tobacco like they do in Australia. There's a the last thing I want to talk about is today was the opening press conference of National Anti-Poverty and Homelessness Week, and there's a direct link, as most of you in the work in the field know, between poverty and health. And as the poverty levels are down, of course, the health problems go up. And so in my answers to the other questions, I'm going to talk about how we're going to work on that too, to indirectly help healthcare for seniors and children's and for the homeless. Thank you.
Thank you. And Melissa, just to start again, your thoughts on the Canada's healthcare system and its place in a national election?
Yes, well, an ECOS poll published last week shows that healthcare is a top election issue, and that Canadians don't feel like it's getting enough attention. And I must say I agree. Canadians value their public, accessible, affordable healthcare system, and the NDP first developed that over 50 years ago. And it's part of what defines us as Canadians. And I want to tell you about the NDP plan that strengthens the public healthcare system. And the NDP has a plan to hire healthcare professionals and make medicine more affordable. And Canada's family doctors agree, and the NDP has the best plan of all the parties involved to invest in better healthcare by starting with 7,000 more doctors, nurses, and nurse practitioners and other healthcare professionals working in community clinics, by reducing wait times for family doctors, lowering drug costs by 30% through a universal coverage plan, tripling the paid leave available for Canadians who are too ill to work, supporting caregivers by expanding the compassionate care benefit so people can take up to 6 months paid leave to care for seriously ill loved ones, and that Tom Care will immediately inform Canada's premiers that Harper's unilateral health cuts have been cancelled and begin to work to develop a new health accord. And the NDP will increase the healthcare funding transfers to provinces and territories by 6% each year, which would inject an extra $5 billion into the system over 4 years. And I've campaigned in every Yukon community and across Whitehorse, and healthcare is an important issue, especially for those seniors and young families, and particularly for those that do not have a family doctor. And I'm very supportive of our party platform, which will provide funding for more healthcare professionals in form of the doctors, nurses, nurse practitioners, and in our community clinics. And in my experiences working as a lawyer in this community of the Yukon, I see the dedication of the frontline workers in dealing with the needs of those Yukoners who are struggling economically and socially. And earlier in the campaign, Tom Care announced the creation of a $100 million fund for a youth mental health innovation, which is part of our platform to reduce wait times and improve access to care. And the Mental Health Innovation Fund will include special emphasis on high-risk populations in First Nation, Inuit, and Métis communities, as well as Canadians in rural, remote communities, and youth transitioning from foster care. And that's basically a summary of our healthcare platform, and I would have liked that healthcare could have been more of a center throughout this campaign, and an idea that we can come together and join and build a better healthcare system here in the Yukon as well as in Canada. And I'm very proud of the system and the foundations of that being part of the NDP, and it's part of the fabric of who we are as Canadians. And when I look at that opportunity, I see that opportunity to have met so many people across the Yukon, and that's the biggest thing. When I think about where you get care, you shouldn't receive something just because we're north of 60, that it should be less than anywhere else from coast to coast to coast. And it's very important as I see my mother beginning to age, and I have other family members. My uncle, I think he's trying to start a baseball team, but he's got a young son addition to his family, and he's only 3 weeks old. So within the spectrum of my own family, I see that healthcare is important. It's from cradle to grave, and it impacts everyone, whether you want to be in the best fit option to impact your overall health, but whether you're going to be part of family members who are adding to their families, or people who want to die with dignity. And when I see that, that's going to touch us all, whether we like it or not, and that's why I think it's so important that we need to talk about and be informed about what each party has to offer, because it's going to touch all of our lives, and we need to be working together as a community to make sure that we address all of those important issues from cradle to grave.
Thank you, Melissa. Currently, we spend over $6,000 per person per year, every man, woman, and child in the country, on health care. It's about $215 billion as of last year. That's up from about $4,000 a person in 2011, and it's about $1,000 more per person than they spend in the UK. Of that, we spend 40% on people over the age of 65. Those people make up 14% of our population. By 2036, that portion of the population will get closer to 30% or double. If the proportions change the same with healthcare requirements, they would be taking up 80% of our healthcare dollar. And some conservative estimates that I was reading last night say 62 to 80% of the healthcare dollar will be spent on people over the age of 65. How do you suggest we prepare for this? And for this question, we'll start with Larry.
Thank you very much. And I want to just continue on with the theme that I left at the end of the last question, which is the poverty effects on health. And so if you reduce poverty, you improve health outcomes. And so we like to do that for seniors and for elders. And we'll do it in a number of ways. One is for the lowest income of seniors who are really in desperate situation. We're going to increase the OAS supplement by 10%. We'll also index the OAS and the supplement to a special seniors indexing, because seniors use a different basket of foods, a different number of services, nature of services than the average citizen. So if you're going to increase their pensions related to inflation, you want to increase it as the amount of the particular things that they use increase to be most relevant. We're also going to negotiate with the provinces and territories to increase the Canada Pension Plan payments because it's, as most of you know, if you have friends or relatives that are seniors, it's very hard to live on the level of pensions that government provides now. We also, with a large infrastructure investment, biggest one in Canadian history, one of the items that's eligible is more seniors facilities, more seniors affordable housing, and more long-term care facilities for seniors. As you know, there are waiting lists for some seniors trying to get into the wonderful facilities that we have here in the Yukon. And in that infrastructure in particular is affordable care for seniors. As you know, they're many of them have very low incomes, no potential to increase those incomes, so they really need affordable housing. And this will help implement two more of the recommendations, 4.1 and 4.3 of the Yukon Clinical Services Study of 2014. In the hospitals in the Yukon, there are a number of people that shouldn't be there. And those are people that related to that they should be in long-term care facilities, which I just talked about, with addictions, where they should be in treatment, or with mental health. And a lot of these people are either in jails or hospitals when they shouldn't be, and they're clogging up those systems and they're getting the inappropriate treatment. So we want to invest in all three of those areas, so it has the people that should be in the hospitals, and not taking up, for instance, I'm told most of the beds in the surgical ward, for instance, are often taken up by people that shouldn't be there, which reduces the amount of surgery that can be done and then increases the wait times for surgery. As I said, in relation to seniors, again, $3 billion in home care to have more high quality home care providers, financial supports for family care and palliative care. Part of our plan, this healthcare accord that we want to do with the province is sort of an integrated system, which I'm sure that a lot of you have already been lobbying for years before government gets around to it. But it'll be multidisciplinary, because obviously seniors, as everyone else, often needs more than one type of assistance. It'll be patient-centered for the things they say they need, and to manage their chronic diseases. A majority of seniors have some sort of chronic disease in the community or at home or in long-term care. The last item I wanted to mention related to seniors is the compassionate care benefit. Often one of the ways of them staying at home where they want to be, they need someone to care for them, a family member. Right now, there is an EI benefit for compassionate care, but we want to expand that. Right now, the the person almost has to have a certificate that the person is very close to passing away within those 6 months. So we want to expand that just so that it's someone that's seriously sick, seriously ill, but doesn't have that very tough condition on it. We also, sometimes helping a person in that type of situation, you know, doesn't take the whole day every day for 6 months, but may take certain hours, but takes it for a longer time. So we're going to allow the extension of that benefit to, of the 6 month benefit to a year. You would get the same amount of money, but it would be spread over the type of hours that you want. And in fact, if several people in your family are taking turns at doing this, we would allow that compassionate care to be spread over the different members of your family that are caring for the senior. And finally, we would make it more inclusive by allowing it to also, if you're staying home with a seriously sick child. And this would cost about $190 million, but it'd come out of the EI funds, and there'd be no increase to EI. There's enough in the EI fund to cover that.
Thank you, Larry. So, Melissa, to reiterate, the question was about our aging population, the proportion of healthcare dollar that they take up, and the fact that that's going to get much worse in the next 10 to 20 years. How do you suggest we prepare for this?
Yes, the NDP will implement its national strategy on aging, a national strategy that would provide dignity and security for all seniors in their retirement. The NDP strategy was released in June 2014 following an extensive consultation with seniors and stakeholders, and after a decade of lack of action by the current government. Our seniors and elders have worked hard to provide society with prosperity, generosity, and sound institutions, and no one should have to grow old in poverty, insecurity, and isolation. As the number of Canadian seniors and elders increases, we urgently need a plan in place to meet their needs and ensure that everyone can age with dignity. We need to make sure that our institutions and vital public services are ready to meet the challenge of providing necessary services efficiently and effectively. All partners need to be working together on this: the federal government, provinces and territories, municipalities, care providers, senior organizations, and most importantly, seniors and elders themselves. And too often, elders and seniors and their family members face difficult choices between entering long-term care, making visits to doctors, hospital emergency rooms, while facing long wait times for care. Access to a range of quality long-term care is crucial. And it's about the choice many seniors and elders would make if they were provided with support to stay in their homes and communities for longer. Aging in Place is supported by the Canadian Nursing Association and Canadian Medical Association. An NDP federal government will expand care for seniors and elders by creating 41,000 home care and 5,000 nursing home spaces for seniors and elders. And the NDP will provide care options for seniors and elders by developing a fund in the range of $40 million for the National Alzheimer's and Dementia Strategy to address these growing epidemics, and improving access to palliative and end-of-life care resources and support. And many family members work hard to care for our aging relatives and friends while being sandwiched between other family and work responsibilities. And that's why the NDP is committed to expanding compassionate care leave for families through employment insurance program so that families can access this program. And the NDP government will also make prescription drugs more affordable for seniors and elders by securing better prices and working with provinces and territories toward universal coverage for all Canadians. And the NDP will create a national drug plan that will help lower prescription costs by 30%. Part of this money saved would come from leveraging the country's bulk buying power. In summary, the NDP will implement its national strategy on aging and some of the components that I've just reviewed, and to address the challenges faced by the healthcare system so that healthcare requirements of seniors and elders don't use up the 80% of the healthcare dollar. I've had the wonderful opportunity in this campaign to meet and listen to seniors and elders from across this territory, and it's about listening to what they envision for their future, and I truly believe that it's about nobody gets left behind and listening to what they envision for their future, and to take care of people how they envision being taken care of. It's not about me telling them what's best, and it's about making sure that they have dignity and that they're consulted about what they want and what they need. And when I see that, some of the elders and seniors, I'm quite frankly are very happy that they're my supporters because they're a feisty bunch. I wouldn't mess with some of them. And as one individual told me at the Thompson Center, he said, "Melissa, what do you think about grey power?" I said, "Grey power?" He goes, "You know, the seniors and getting our voice out." And I said, "Absolutely." And that's what part of this election is about, is making sure everybody's voice is heard, and also including, as one individual said, grey power. And I said, well, I often tease my mom now that she has lovely white hair. I told her that we should come out with a new brand and call that Arctic Blonde. But it's such a blessing to meet people and have them give me input on how we can make Yukon better and improve our healthcare system for seniors and elders.
Ryan, to reiterate, it's $6,000 per person per year in the country spent on healthcare, with a lot of it going towards seniors that are only getting greater in numbers and greater in needs. How do you suggest we prepare for this?
Well, I was looking at the numbers, and by 2030 was trying to do the math and see how old I would be, and I've heard the expression that 40 is a new 20, so that makes me 21. So by then I'll still only be in my late 40s, so it won't affect me. You know, it's an interesting question. Exactly how do we prepare for what we can't stop, and we can't stop the hands of time. And we've heard some of the comments across the board here right now that are very similar, in fact, in our platforms. The extended compassionate care benefits through the EI program from up to 6 months to try and take care of families that are supporting those who have compassionate care needs. Larry talked about prevention as a key theme. We've all talked about the dynamic relationship between housing, poverty, food security, active and healthy living. All of these are fundamental pieces to the prevention end. They're also fundamental pieces to management of either chronic disease or the natural aging process that creates a little bit more attention and time required in the healthcare profession. One of the things that I think that we can do fundamentally to prepare for what we know is coming, which is our aging population, is again working directly with our communities, determining on a community by community basis exactly what the needs of that community look like. There's going to be some shift in those demographics and we're seeing that right here in the Yukon. Our population is starting to age in a way in which it didn't before. And that's a result of a number of things. It's a result of economic opportunity in the community. It's a result of a growing community. It's a result of families deciding to stay here now later in life. When I was younger, Whitehorse, the Yukon really wasn't a sort of that quote-unquote retirement place. People are moving here now later in life to be with their families. We're starting to see people come here because of some of the generous benefits and opportunities and supportive services that the Yukon has. So we have to be able to adjust to that on a continual and flexible basis, where I think a national framework works well to point out what you do in a framework of aging, but I think a national strategy that becomes at risk a one-size-fits-all solution isn't the answer for us, because as I mentioned before, not only do our priorities differ between Watson Lake and Beaver Creek and Old Crow and Whitehorse and all points in between, they're certainly going to change between Corner Brook, Newfoundland and here. So we need to really be responsive to the community groups and organizations that know exactly how the dynamics of their community are changing on a weekly, monthly, annual, and a projected future basis. I think a cornerstone to this obviously is supportive housing. So when you look at some really great examples here in the Yukon right now, seniors' homes have opened up in communities, Haines Junction, Watson Lake. We've opened one as recently as a month and a half or 2 months ago now in Mayo. And when I was there at that facility looking at what they're able to provide, they're able to keep community members there longer. They're able to provide healthcare services in that community for them at that time, which reduces some of the overall stress on the healthcare system. But what it also does is return some value to that community. And I mean that when I say that, what do I mean by that? I mean you have people in the community who have lived there a lifetime. They have a lot to contribute. They have a lot to teach and inspire the other people in their community. Teach traditional ways of living, teach historical facts, and that generates community health. Because health to me is not just physical health, but it's mental health. And those things can be formed when the mind and body are one. Those things can be formed when you have a positive worldview and a healthy outlook and positive potential outcomes. And the support services right around you, and the core support and the strength of your family, the core support and strength of your community, and the core support and strength of the organizations that can work with you. And I could run through the numbers of millions here and billions there, and the dollar-based investments that we're looking at doing to respond to the aging population. But fundamentally, we need to start with the people who know best in their communities, and the federal government then gets behind those community groups, those community people, the community care professionals, the health professionals like you, who can identify the specific needs and make a difference in the community. And that invariably will make a difference in this territory and in turn make a difference in our country. So now I think we respond to it by dealing with each dynamic that we've talked about: housing, nutrition, food security, healthy and active living, support groups like the Golden Age Society that are helping people not only age with dignity, but being active well into life. My grandma's 92 years old, and I'll tell you what, she is a going concern. She fought going into supportive care tooth and nail. And that's what we want to see, people that are still active and engaged and ready to go when they're in their 90s.
Thank you, Brian.
Thank you.
So back in the 1970s, I mean, the way that we've delivered healthcare in Canada has changed quite a bit over the decades, but we had a system where the payment for healthcare was split 50-50 between the provincial governments, provincial, territorial, and the federal government. And then it slowly changed and has constantly been downgrading what comes from the federal and what is expected of the provincial and territorial. Although the Yukon is still largely dependent on the federal government, this trend has altered what it means to have a national healthcare system. This also combined with the fact that as I think Larry alluded to, the Health Accord ended in 2014. The last national strategy that we had for healthcare from 2004 to 2014 ended, and there is a vacuum where it existed. So how will you support national healthcare standards if elected? And this time we'll start with Melissa, please.
Yes, Canada needs a national government that will be in true partnership with the provinces, territories, municipalities in the delivery of healthcare. In the ECOS polls that I've mentioned a number of times tonight, when asked which level of government should protect, promote, and improve Canadians' health, 64% of the respondents said the responsibility should fall on the federal government. However, 48% of respondents said that they had more confidence in their province or territory on that issue, and I wonder why. And when we look at the end, as we just alluded to the healthcare accord, we're looking at the fact that we have the federal government's leadership role in healthcare just ended, leaving Canadians vulnerable to variable standards of healthcare from coast to coast to coast. And a Yukon healthcare review notes that federal government has provided additional and specific health-related trusts and funds to the North, acknowledging there are special requirements, inadequate transfers, and needs of the North. These funds must be renewed or replaced with adequate funding for health in Yukon if healthcare programs and services in Yukon are to attain national standards. An NDP government will support and play an active role in the development and maintenance of national standards of healthcare. An example of this is NDP's healthcare vision is from our former health critic Libby Davies, who introduced a private member's bill. And that was the Continuing Care Act, which would have required the setting up of a special advisory committee to conduct a pan-Canadian assessment of Canadians' home, long-term, and palliative care needs, leading to an establishment within 2 years of a national standards for delivering continuing care services. It also required the minister to conduct a national assessment of needs of Canadians in terms of continuing care. However, sadly, needless to say, the health minister, Ronan Ambrose, has not adopted that approach. If we are to have national standards of healthcare, federal government should be playing a leadership role. Otherwise, the potential of patchwork of standards from primary to acute care and everything in between will prevail. I'm told there are more than 70 standards for quality of healthcare across Canada, and many services promoting population health are delivered by primary care providers in the community. Their standards address the importance of primary care, the importance of integrating services across the continuum of care. When we look at this, we need federal leadership that hasn't been there for the interest of these issues, and we need not to be abandoned in national role in funding, maintaining, and improving our national healthcare system. And we have to ask ourselves, looking back in the history books, of what former governments and whether they can be trusted on their liberal promises. And when you look at that, it's about supporting healthcare professionals to achieve that gold star standard. And when you look at practices like this can't be just about books and paper that it's written on. People depend on looking at standards of practice for registered nurses, and those things can be held if we cherish our healthcare providers and provide them with the proper support and training and access to, whether you have a job in Newfoundland or Nunavut or Vancouver, that you feel that you are being supported in your profession, that you can provide and live up to the standards of practice set forward, in which you as a group have put and maintained and achieved that gold star, maintaining of that requirement. Because it's important, because when you think about healthcare, sometimes it's about that preventativeness, and you can seek that out. The opportunity for community healthcare to come out and talk to community members about preventative healthcare, like doing opportunities about whether that has to do with blood pressure or sexuality and all of those kind of things. But if they're not able to do and pinpoint some of those key issues in their community and do that kind of preventative work because they're on call or they have to rush off to deal with other issues and aren't able to establish that community connection and establish what the community needs are because they're run off their feet and they're feeling like this is up for grabs of a standard of practice because of the nature of they're not being supported. And that's where we can work together and have some federal leadership in that issue so that we can all obtain that gold star standard of care across Canada.
So next we'll have Ryan, and just to reiterate, the preamble was about the passing of the buck that tends to exist between different funding organizations federally and locally, and then the lack of a national healthcare accord, leaving us without a national vision on healthcare. So how would you support national healthcare standards if elected?
So I mentioned this in my opening remarks that healthcare is not often, it always is a very guarded portfolio at the provincial level. So when you start talking about what the federal government will do or will impose, you do walk a very fine line between overstepping jurisdictional responsibility and what the provinces feel is ultimately their responsibility to deliver. At the same time, what you're going to be able to deliver at the federal level in terms of core and sufficient funding support so that the delivery of those services are responsive to the needs of the province or territory in which you're dealing with, without overstepping your jurisdiction and without importing a federal view on exactly how services need to be delivered in that province or territory. In the Yukon, we can look at the transfers that we receive here, and now up to $35 million in health transfers. We have a health formula financing agreement that's not based on a per capita arrangement that was proposed in the past, that we soundly rejected at the territorial level because it would have put us at a significant disadvantage in terms of healthcare delivery system. If we were based on a per capita system, we wouldn't have been able to afford a hospital, never mind any of the other ancillary support services that need to come along with it. So currently, the Yukon has $35 million through the Canada Health Transfer alone. That's an increase of $13 million since 2006. So those are significant increases. But when we talk about it, and I hearken back again to localized priorities and investments at the community level, local level, to meet the needs that are responsive to a territory and all the communities within it. And I'll give you one clear example where we have to let provincial or territorial jurisdictions take the leadership role in what they set as their delivery systems. Nunavut right now is one of the few provinces in our country that is rapidly getting younger. So their future healthcare needs are very, very different than ours. And they're going to be very, very different from other provinces that have currently an explosion in aging population. So to set a standard of delivery when the differences are so unique would put us off track a bit. So while we need a standard of care in Canada that everybody can rely on, that everybody knows when you go into a hospital in one location or another, your wait times and your quality of care and the service delivery that you're going to get is on par with the rest of the country. That's a goal we need to achieve. That's something that we absolutely need to work toward. But the priority of the system within that province needs to absolutely be independent and responsive to the needs of the people within that province. Because again, when you look at that Nunavut example where you have, for all intents and purposes, times babies having babies in that province, they're younger, and we need to focus then on different types of maternal support systems. Here in our territory, we're looking at more of an aging population and supporting aging with dignity initiatives and housing initiatives. So they're all ranging across each provincial boundary. And the federal government really relies on the provincial ministers and territorial ministers to come to the table and negotiate what's going to be in the best interest of that province. To do that collectively for a standard of care, I think is a wonderful objective. I think it's something that we can achieve broadly in Canada. But I think in terms of the direct service delivery, point service delivery, the best people determine what that will be are you right here in the communities, based on the dynamics of this territory, based on the dynamics of each community in this territory. And that's what's going to provide us with a strong healthcare system, because it's ultimately responsive and it's going to meet the needs of community members here, and not a broader envelope and pit us into jurisdictional debates between who's supposed to deliver one service over another. And it's an interesting challenge. We have these discussions at the provincial level all the time, with the territorial health ministers, with the provincial health ministers, what the federal government does in terms of imparting certain jurisdictional authority on them, and it is very much guarded by the provinces. So we need to make sure that the funding is available. We need to make sure that the funding is responsive. We need to make sure that that it's meeting the needs of each and every province. And I stand firm behind the notion that who's best to dictate that are our territorial partners, our territorial governments, our First Nation governments, and our local communities and healthcare providers and the groups and organizations in this territory that are working with this each and every day.
Thank you, Ryan. And finally, Larry, again, to reiterate, without a national health accord and differing ideas on who should pay for what, how would you support national healthcare standards if elected?
Thank you, and I'm a big supporter of the national standards for not-for-profit, universally accessible, publicly delivered, affordable health care. And to ensure these standards are maintained as we move forward, as you said, when the accord that we struck with expired in 2014, we would sit down with the premiers of all the provinces and develop a new healthcare accord. And that's how you maintain these standards that are so important, national standards across the country. When you have an accord, and in that accord would come funding, and the funding would provide secure funding for the Yukon government so that they would know they'd have stable funding, but it would also have the standards that they're accountable to for that funding. As I think I briefly mentioned, one of the parts of that strategy would be integrated primary care, which you've been asking for years, with multidisciplinary approach, because there's all sorts of providers that could be work together to provide on a particular case. We'd manage chronic diseases at home or in the community or in long-term care facilities. So to be able to pay to keep up these national standards that is so dear to us all in Canada, it's one of the primary things we're proud of in Canada. To keep those up, you have to provide funding for a number of things to the territorial government and the provincial government so that they can do that. So as I said before, we have the $3 billion in home care. We'd help fund the affordable seniors housing and seniors facilities and long-term care facilities. We'd expand the compassionate care benefits. And I mentioned before, I'd talk a bit more about how we would help with the prescription drugs. So we would, as I mentioned, the bulk purchasing. We would support and disseminate information on research and best practices to reduce overprescribing. You probably know as nurses, some patients that just they're on all sorts of, elderly patients on all sorts of drugs, and they may not need that whole plethora of drugs. I've talked to one recently actually who've cut out a lot of their drugs and felt a lot healthier actually. So we would also decrease the number of adverse drug reactions by doing research across the country and finding out, who had the reverse reactions and how those could be prevented. And these types of things that we do nationally, there may only be 1 or 2 instances in the Yukon, but to get the experience from across the country, that sharing of that will be very helpful for us. We also would have timely approval of new medicines. You've probably heard of new medicines that are working well in other places, but it takes so many years to get through our approval system. And while that's happening, people that could be cured or eased of their pain are missing them, and it would also then reduce costs. We'd also review the rules of the Patent Medicine Prices Review Board to ensure that governments and individuals are getting their value for their money on brand name drugs. I remember when I was in Parliament, I was waging a battle with some of my colleagues on just the extension of patents that for the brand name companies, it just increases the price that people have to pay before the other ones can come on stream. And so I think that's a very important part of our platform. Finally, as I talked at the beginning, near the beginning, about the effect of poverty on healthcare, I'm sure many of you have seen the very same homeless patients a number of times coming into the hospital. They're there much more frequently for obvious reasons, and that's a burden on them, a human tragedy on them, and a burden on the system that doesn't need to exist. So that's why we have a huge investment in shelters and affordable housing in our platform. And probably the most vulnerable are the children. And this is one of the things I'm most proud of in our platform is the 40 million more for the food mail to help the children in the high Arctic, and then the Canada Child Benefit, which for low-income families would add $500 a month non-taxable for each child in the family, and that's a lot for food and shelter and to keep those children healthy. Thank you.
So I'm going to switch things up a bit because we had, I think, the fourth question. A lot of the aspects in that have been covered in the other 3 questions, and everybody's sitting patiently. And I know that there's a lot of wealth of information and perspectives out there. So I'd like to open up the floor to questions from people in the crowd, and we'll keep initially at least the answers to 2 minutes so that we can have many questions. And if everybody's shy, then I will go on to my final question. I don't have a mic in the crowd, but it's a small room, and I know most of your names. Yes, Sandy.
Hi, I'm Sandra Dahl, and just to let you know who I am, I'm the president of the Yukon Hospital Corporation Group of the Public Service of, the Professional Institute of the Public Service of Canada. I've been meeting with my colleagues in Ottawa, and over the past 3 years, there's been a significant decrease in the professionals working in the federal public service. These are the people who keep our food and water safe, our highways safe. They are part of healthcare, and they are being decimated by the present government. And I would like to know what each one of you feel about that and what you can do to help prevent this from happening, because these are the people who help to keep us healthy and safe in this country.
Thank you, Sandy. Ryan, can we start with you?
Sure. Well, I don't disagree with you that the federal public servants, I've been one, provide great service to Canadians. There's absolutely no question about that. We obviously have to deliver services that are responsive to our budgetary abilities and make promises and create budgets for all departments that fit within a balanced framework. I would say this, that when we look at Yukon service delivery here in this territory, whether it's healthcare or highways, as you mentioned, or other systems that provide safety for Yukoners, the Yukon Public Service, Yukon groups and organizations, Yukon individuals provide tremendous amount of public service, public support, and our territory is growing and thriving. We've done exceptionally well, and that's largely been at the hands of a federal government that has astronomically increased transfer payments to the territory. Some $923 million of federal transfer comes into the Yukon every year. That allows the territorial government to deliver a $1.4 billion budget to take care of their social responsibilities, their healthcare responsibilities, their education opportunities, their environmental concerns, and the economic potential of the territory. I would hazard to guess that on a per capita formula, there is no province in this country that receives the level of federal support that the Yukon does to take care of its people. $923 million direct transferred to the Yukon in just transfer payments alone for some 37,000 people. Combine that with the $373 million in infrastructure payments to the Yukon that grow jobs in the economy and put Yukon people in the private sector outside of the public service to work each and every day. And this territory is exceptionally strong and growing quite well.
Thank you, Ryan.
Thank you.
Larry?
Thank you. Yes, we too were very upset at the cut in inspections. I remember at the time of the tainted bee when people were actually dying of that, and there was actually health inspectors being cut, not increased at the time. And also related to food grains, there were certainly cuts related to inspection and the types of inspections related to our food grains. So there's been, and it hasn't been just those departments that have been cut for services to people. There's the VI, Veterans Affairs, EI, Immigration, Canada Post, CPP, CRA. A lot of areas have been cut in the federal public service. So that's what the government's been doing. But some of the public service people are leaving, I think, because of the lowest morale in decades in the federal public service, and part of it is things that have been done to them, like C-59, where they legislated change in the sick leave without going to the negotiating table. It was just thrust upon you, not negotiated with you. The federal, Liberal government would implement the Mental Health Commission recommendations on national standards for psychological health and safety in the workplace to help federal employees that need that type of support, health support. So I think, and finally what we would do is revisit the offending parts of the Omnibus Anti-Public Service Bill, C4, and once again, that was anti-union, and we should, obviously we won't agree on everything, but we should down and fairly negotiate with you.
Thank you, Larry.
Yes, I too have been a public servant, and I come from my mother, who spent 27 years as a public servant, and certainly put food on my table and sent me to university, and I wouldn't be here without her exceptional guidance and opportunity that she was able to take as a federal public servant. And when I realized that there's been why this election is so important. It's not only just our 42nd election, but there's so many things that are at stake in relation to protecting and standing up for our public servants, to having clean water, to the decimation of our environmental laws, to all of those aspects, which has eroded our ability to feel proud as Canadians and look at our international standards of how we used to be peacekeepers and be the frontline workers to help, not to be the frontline workers to be on the aggressive part of that. And when you look at that aspect, it's about wanting better for Canada and looking at some of those aspects of supporting the public servants and recognizing that it's this aspect of nobody gets left behind, and this aspect that looking at things that the NDP has to offer about access to clean water as a human right, something as fundamental as that. And I grew up being underhoused and living in a house without running water. And when I looked at that, that was an aspect of protecting your water. You had to keep it on the inside, you had only certain tools that you could use for it, and you only had to use certain amounts because it wasn't going to be delivered all the time and always be accessible. But that to me is the fabric of who I am, about the idea of the need and the urgent need to set those standards for ourselves as Yukoners and as Canadians.
Thank you. And thank you, Sandra, for this. Who else has a burning issue about healthcare that they'd like to know where the candidates stand? How about we talk about how people between the age of 25 and 54, 1 in 10 have a chronic disease. But once you get over the age of 55, it's 4 out of 5 have a chronic disease. Chronic disease takes up something like 70% of the healthcare budget. Anybody have a question about how we're going to spend money on that?
I think you just did.
So do you want to answer that? Chronic disease, what are your thoughts? Larry?
Yeah, well, I already addressed that when I talked about seniors, and I said that a majority of them have at least one chronic disease. Some of them have 2 chronic diseases. It takes up a huge amount of funding in our healthcare system. So we want to try and manage it so that those people are where they're happiest, and sometimes that's at home. And so if we can provide more high-quality home care, including nurses, to go to the home so that they're not taking up hospital beds away from their family and friends, where a lot of them want to be. That would be one way. They could be in community facilities as opposed to the hospital, where there's more social activities, as much care as they need, various stages of care, depending where they're at, or in having sufficient lawn care facilities so they're not making your problem more difficult by filling up hospital beds when that's where they shouldn't be.
Thank you. Melissa, what are your thoughts on managing chronic disease?
Yes, taking a preventative approach to healthcare is one of the 4 major elements of our healthcare platform. Healthy aging, I believe, starts at birth. And when you're looking at that, you're looking at promoting healthy and active living for individuals of all ages. And the federal government can take a leadership role in coordinating efforts to deal with the chronic illnesses and conditions and strategies to deal with things like diabetes, dementia, and other major health concerns, so that we can recognize those challenges and set those benchmarks and make that available of a standard of care for all Canadians, no matter where you live. And looking at those aspects, you're talking about a preventative or proactive approach to healthcare, and looking at providing targeted funding to improve for other health outcomes for those most at risk, including Aboriginal and Métis and Inuit people, expanding national diabetes strategies and looking at screening and better chronic disease management for those at risk communities, and looking at strategies even in the north where we're dealing with young people who don't even get the opportunity to age because they're killing themselves. And the idea of suicide prevention, when you have people as young as 11 years old in Nunavut who it's over before they even get started. And that is a national crisis that we all own. And we have to build in strategies so that, you know, those young people, as Mr. Lee said, as part of Nunavut, can live past the age of 11 and have hope for the future. And when you raise that standard for all of us, you know, if you live north of 60 or elsewhere, that we can all live better and take care of people so that they don't feel hopeless in the end their very own lives. And it's so important when you look at that opportunity to be preventative and proactive. And it's all a community resource. I mean, I look at that idea that nursing is a holistic care. And I think about that opportunity of the frontline work that nurses do and come into contact that could be meaningful before somebody has their chronic disease go off the charts, or before they feel hopeless and go home and end their lives, and that's it, and the light is out. And it's so many opportunities that people can change lives with, an opportunity to have those standards and care for one another and feel proud of that. Thank you.
Thank you. Went a little over 2 minutes there, but when she started talking about the nursing paraphernalia, I really couldn't stop her.
Good call. Thanks. You're honest with that.
Thoughts on chronic disease?
No, you're okay. So we know in the north that we suffer rates of some chronic diseases 4 times higher than the national average. Diabetes is a great example, and it affects the Aboriginal First Nation population in our country at rates that are absolutely alarming. And that's just one example of chronic diseases that need to be managed in the north far differently than southern Canada. I'll quickly list this in respect to my 2-minute time frame, though. We supported the. I'll just read a quick list here. The Canadian Institutes of Health Research. There was 6,844 investigators that participated in these grant-fueled programs that did. We funded $160 million in research for combat cancer, $97 million focusing on children's mental health, $71 million for cardiovascular, heart and stroke, $55 million to support research related to mental health and behavioral conditions and traumatic brain injuries, $53 million for stem cell research, $43 million for diabetes-related research, $37 million for research in Alzheimer's, and $30.7 million in Aboriginal health. This is all around health innovation. This is just one portal of 100 other portals that exist that fund these sorts of things. That's at the national level. At the local level, we're investing in the exact same things, but again, driven by local priorities and community needs. And in 2012, I started based largely because of a young boy who had the courage to come to Ottawa and talk to us about juvenile diabetes and the great work that he'd done in this community to raise awareness and funds for that, and started an initiative here called Border to Border to run across the Yukon to talk to communities about food security, healthy dietary choices, active living, and the realities of diabetes in the territory. And that, of course, spurs on discussions of all the other things that contribute to or make management of chronic diseases easier or more difficult depending on the conditions in which you're living. Another great local success story is the community gardens programs and the Northern Greenhouse initiatives that we're investing in to provide food security solutions for northern communities. The Old Crow grocery store, another great example of bringing of fresh, affordable food into a community that very much needed that for a long, long time. There's still a lot of work to do in remote locations like Old Crow and across the Canadian North to make sure that local food security solutions are there for them. That includes solutions around country foods and traditional foods, and allowing access to land-based products, whether that's caribou or seal, and defending traditional rights to access, harvest, utilize, and sell those products for the benefit of their community. And those kind of things will start to drive at the real-life solutions for chronic disease management in the territory, and they're creative and innovative ways of dealing with them. There's no one fits all solution, but these are the innovations we're looking at, and we're looking to you to help us work with those.
Thank you. Of course.
I'm Doris. I'm an RN at the hospital. My question is more of a broad question. I hear a lot of promises, a lot of this is what we're going to do, and I find that in upper management type things, there's a lot of things that get put in front of you, and it has to jump through a lot of hoops to eventually get accomplished. And being that it may be a minority government, or if it's a majority government, then it's not an issue. But if it's a minority government, then you're implementing some of the strategies that you're saying. How do you expedite it so it actually becomes accomplished? What would you do?
Can we start with Melissa this time, please?
Yes, thank you. I recognize that it is about some of these systems of the way things seem to work and putting some of those barriers in front of getting things done. And it's frustrating because I too have worked in larger systems like the justice system, where you are the frontline worker and you're dealing with limited resources and limited opportunities and trying to sort things out. So I too have been in your shoes, and it does get a little frustrating. And if there is an opportunity that I see federal leadership to take, is to make sure that we don't forget about those aspects and things that we can do and manage right away. To have a health care accord without just being in limbo, first and foremost, and listening and talking to those individuals that can have some of those valuable input about priorities, and as well as a member of parliament. To me, the key issue of a member of parliament is to be the voice of the people and to be listening to what they want and what they have envisioned for their future. And it's not about asking people how you're going to vote or saying, well, this is just my party platform and off we go. Oftentimes those things are a little easier if you share those values of your party platform. But I also recognize the need north of 60 and some of the urgent things that need to happen and some of the critical things, all the way from that spectrum of care that needs to be looked after and to prioritize that for sure. And it's something that I commit to being that voice and working towards that so that we can move towards that.
Thank you. And excuse me, Ryan.
That's a great question, and it was a frustration that I experienced moving from frontline work into senior management here in the Yukon Territorial Government when I was working at the correctional facility. To answer your question directly, how do we take words and deliver it with action? It may sound simple, but here's my thoughts on it. We make a one-window approach for applications, so there aren't multiple tiers of approval check boxes that start to create the red tape that drags the approval of a project on. We make sure that the categories for application are succinct and streamlined, because the one thing you hear perpetually, and I've heard this for 15 years in government, and it's with NGOs and with government, you put more resources toward applying for something and reporting on it than you do actually getting money and delivering. And that makes no sense at all. What you've got to do is have a system in place where there's a one-window approach, the red tape is at a minimum, the accountability structure is there so we can report to the taxpayer that we're delivering on what we've applied for, but that it's not so onerous that it becomes ridiculous to even bother applying for, and that half your expenditures of that program are spent on the administration of and not the delivery of those services. So how do we do that? We create that one window approach, we create sensible timelines, we create sensible reporting structures, and we make sure that there is a very succinct and streamlined chain of command that moves that up. and a defined timeline for the people that are tasked with reviewing that they actually have to adhere to. So your application doesn't sit in a portal for months on end and disappear, or so that you don't get funding in March and are told you've got 31 days to spend this when it was a year-long project that you've had. I mean, that's the perpetual frustration of NGOs and government employees and all of us in this system. Reduce that red tape, get it down to something workable and manageable, and get the money out the door. And you know what? If it's not perfect, we'll learn from that experience and we'll fix it. But this fear of having everything perfect before you do something paralyzes us and never lets us deliver anything in this territory or broadly across the country. That's how you fix it.
Thank you, Ryan.
Thank you.
Thank you. Yeah, I think the barriers could be in a couple places. One is, of course, there's a lot of regulations, rules, hurdles to get over to get anything done in government. And I think if the initiative is coming from our government, from a government, you need to, and if you really believe in it, then what you're going to do is help the employees, the bureaucrats get around those hurdles. When they tell you what the hurdles are, what's causing a slowdown in implementing that which you believe in, then you have to help them get over those hurdles and get past those things that could be used by someone that didn't want the initiative to kind of stall it. I was parliamentary secretary to a couple of ministries, and I think if you give the direction, a strong direction that these things need to be done, come to me as to why it can't be, and so we'll solve that. But you certainly need to show that this is initiatives come from the people. This is what the people want, what we've promised. And then you have to deliver that. I think the second part of your question was about minority government, and you're right. Obviously, it's more challenging to deliver something in a minority government, and what you need is a lot of cooperation. And I remember from my experience in Parliament, I was on a lot of committees, and there was a lot of issues where the parties in the opposition, ourselves and the NDP and the Bloc, saw eye to eye on a lot of things, whether it was justice or Aboriginal affairs. We certainly could work together, and as some of you know, I was voted just to show that I have the ability to work with the other parties, voted the best constituency MP in Canada, and that was voted by people of all the parties in Parliament, which means if I didn't treat them with respect in Parliament, they wouldn't have voted for me. So it shows that I could work with them to get things through for the Yukon and to get the things that we would need done in, as you said, what looks like a minority government.
Thank you, Larry. We have about 35 more minutes with the room, and not everybody wants to put up their hand and yell a question out amongst the crowd. So the candidates have agreed to stick around and mingle and have a drink, and please don't hesitate to grab them individually and ask a question or a clarification of something that was said earlier. And I guess in closing remarks, I want to thank everybody for coming. I know that, I alluded to how busy the candidates are, but I know we're all busy. But this is important. Not just because it's about healthcare, but it's about democracy. And again, I thank you all for coming. I don't think I have to convince you to go vote on Monday. I'm sure that everybody here will. I will actually encourage you to tell 2 or 3 of your friends that you think might be on the fence, or who might be saying, it doesn't make a difference. It does. And we need to have everybody's voice. And my closing remarks to the candidates, again, thank you for coming out. I don't expect you to have all the answers, but when it comes to healthcare, part of my strategy for having you here was so you can memorize those faces, because they have the answers. Those are the people that work in healthcare, work with patients, hear where the challenges are, hear where the barriers are, hear where the holes are. And I mean, that's what I wanted of a government, whoever gets in, is the ability to ask the right people the right questions when you need the right information. Thank you.
Thank you.